Consider this question carefully. The last time your physician evaluated your blood sugar, and chances are that has happened more than once, did they also determine whether your pancreas contained adequate zinc? Not your A1C, not your fasting glucose, not your after-meal readings. Zinc, the mineral your body relies on as a structural component for packaging, storing, and releasing insulin. The same mineral that pancreatic beta cells, the cells responsible for insulin production, accumulate at concentrations documented by Stanford researchers to be as much as 1,000 times higher than nearby tissue cells, because their function depends on it. Research continues to show a consistent pattern. Zinc deficiency appears in roughly 40 to 60% of individuals diagnosed with type 2 diabetes. In certain high-risk groups, the proportion is even greater. Yet during a standard diabetes appointment, extensive glucose testing is often performed while zinc status is never evaluated. This becomes important because there is one seed, available in most grocery stores for less than $6 per pound, that provides more highly available zinc per tablespoon than nearly any other plant-based food. That same seed also contains compounds associated in peer-reviewed studies with beta cell differentiation, the biological process through which dormant reserve cells can develop into insulin-producing cells when the appropriate signals are present. The discussion centers on that seed, the amount used, the preferred preparation method, and 3 additional seeds that influence entirely different aspects of blood sugar regulation. Together, they create a morning routine grounded in published clinical evidence. For many years, type 2 diabetes was viewed primarily as a condition that needed ongoing management rather than one whose underlying biology could be improved. Blood sugar increased, medications were added, doses were adjusted, and complications often followed over time. Over the last decade, however, scientific findings have shifted. One of the most significant developments is the recognition that pancreatic beta cells are not necessarily locked into a one-way decline. Under suitable biochemical conditions, they can be supported and protected, particularly during early and moderate stages of type 2 diabetes. Research suggests that pathways involved in recovery and regeneration remain available, and compounds found in common seeds appear repeatedly in that body of work. Think of the pancreas as a garden bed and beta cells as the plants growing within it. During youth and metabolic health, the soil is rich and full of essential minerals. Plants thrive, production remains strong, and when older plants disappear, new growth emerges from seeds already present in the soil. Over decades, however, continual demand can gradually exhaust the mineral content. Zinc, magnesium, manganese, and other micronutrients become depleted. Existing plants continue to survive but perform less effectively. They become more vulnerable to stress. When older plants disappear, replacement growth struggles because the resources required for germination are no longer available. At the cellular level, this mirrors important aspects of type 2 diabetes. The challenge is not only damaged beta cells, it is also a metabolic environment lacking many of the foundational nutrients required for normal renewal. Reserve progenitor cells may still exist, but the biochemical conditions needed for activation and differentiation have become less favorable. The key question becomes whether those conditions can be restored. This concept leads directly to pumpkin seeds. Pumpkin seeds, also known as pepitas, serve as the foundation of this protocol. They may be among the most overlooked foods in discussions of metabolic health for older adults. Their first major contribution is zinc. A 30-gram serving, approximately 3 tablespoons of raw pumpkin seeds, contains about 2.2 milligrams of highly available zinc. Among plant foods, few provide more. This matters because insulin functions as a zinc-protein complex. Within beta cells, zinc ions help insulin molecules achieve proper structure, support packaging into storage granules, and preserve them until blood sugar levels signal release. When zinc intake becomes insufficient, the process can become impaired before insulin is even released. Pumpkin seeds also provide substantial magnesium. One serving supplies approximately 37% of daily requirements. Magnesium plays a crucial role in insulin sensitivity. Muscle cells use magnesium to activate GLUT4 transporters. These transporters act like entry points that move glucose from the bloodstream into cells where it can be used for energy. Insulin normally stimulates this process. However, when magnesium is lacking, the transport system may not respond efficiently. Insulin signals are present, yet glucose uptake remains reduced. This contributes to insulin resistance. Studies indicate that magnesium deficiency affects between 25 and 48% of individuals with type 2 diabetes, with potentially higher rates among those with poor glucose control. Because pumpkin seeds provide both zinc and magnesium, they contribute nutrients directly involved in insulin production and glucose utilization. The first pathway in this protocol is zinc-supported insulin synthesis and beta cell differentiation. Beta cells maintain exceptionally high zinc concentrations. Stanford researchers documented levels reaching approximately 1,000 times those found in neighboring tissues. This dependency is so pronounced that zinc concentration itself can be used to identify beta cells within pancreatic samples. Every major stage of insulin production depends on zinc, from gene expression through assembly, folding, storage, and release. Research published in the Journal of Nutritional Biochemistry reported that providing dietary zinc sources to zinc-deficient diabetic subjects resulted in statistically significant improvements in fasting glucose and insulin secretion capacity within 8 weeks. Additional findings indicate that zinc can increase activity of transcription factors associated with beta cell differentiation, supporting formation of new beta cells from reserve progenitor populations. The second pathway involves magnesium and GLUT transporter activity. GLUT4 dysfunction is considered a major contributor to insulin resistance. Correcting magnesium deficiency remains one of the most extensively studied nutritional approaches for improving this process. A 2025 meta-analysis combined data from 23 randomized controlled trials involving 1,345 participants with type 2 diabetes. Magnesium supplementation produced significant reductions in fasting blood glucose. Subgroup analysis revealed the greatest benefits among adults aged 65 and older who maintained supplementation for longer periods. For individuals in early or moderate stages of the disease, clinically meaningful reductions in fasting glucose, achieved through correction of a mineral deficiency, represent an important finding. The third pathway focuses on sesame seeds and liver glucose regulation. Many diabetes strategies focus almost exclusively on insulin and overlook the liver's contribution to blood sugar control. A considerable portion of fasting glucose originates not from food consumed the previous day, but from hepatic glucose production. During type 2 diabetes, this process can become dysregulated, causing the liver to continue releasing stored glucose overnight despite prolonged fasting. Sesame seeds contain lignans, particularly sesamin and sesamolin. Research indicates these compounds can suppress the activity of glucose-6-phosphatase, an enzyme heavily involved in releasing stored glucose from the liver. By reducing excessive enzyme activity, sesame lignans may help decrease overnight glucose output and support lower fasting blood sugar levels through a pathway separate from the mechanisms associated with pumpkin seeds. The fourth pathway involves sunflower seeds, vitamin E, and post-meal glucose control. Sunflower seeds rank among the richest plant sources of vitamin E, especially alpha-tocopherol, the form most frequently associated with antioxidant protection. Beta cell membranes are especially vulnerable to oxidative stress and chronic inflammation. Vitamin E may help support these structures. Sunflower seeds also provide chlorogenic acid, a polyphenol compound that can inhibit alpha-glucosidase, an enzyme in the small intestine responsible for breaking complex carbohydrates into absorbable glucose. When alpha-glucosidase activity is reduced, glucose enters the bloodstream more gradually after meals. This results in smaller post-meal glucose increases, reduced insulin demand, and potentially less stress on beta cells. The same biological target is used by the diabetes medication acarbose. Chlorogenic acid offers a naturally occurring source of similar enzyme inhibition. Several studies were highlighted in support of these pathways. A controlled clinical trial published in the Review of Diabetic Studies during 2025 examined adults with type 2 diabetes who consumed pumpkin seed powder daily for 6 months in addition to standard care. Compared with standard care alone, participants receiving pumpkin seed supplementation experienced meaningful reductions in HbA1c, statistically significant decreases in triglycerides, and improvements in multiple lipid markers. A 2025 systematic review published in Nutrition Reviews by Oxford University Press analyzed 9 controlled clinical trials involving 316 participants. Researchers concluded that pumpkin and its bioactive compounds demonstrated consistent potential to improve glucose-related outcomes and metabolic biomarkers among individuals with or at risk for type 2 diabetes. A 2023 systematic review and meta-analysis published in Phytotherapy Research evaluated 8 randomized controlled trials involving 395 participants with type 2 diabetes. Sesame consumption reduced fasting blood glucose by an average of 28.61 milligrams per deciliter and lowered HbA1c by 0.99 percentage points compared with control groups. An Iranian randomized clinical trial also documented significant reductions in hsCRP, a recognized marker of systemic inflammation, among participants consuming sesame daily. Research from Harvard's T.H. Chan School of Public Health followed 85,060 women for 18 years. Higher magnesium intake, largely from whole food sources including seeds and nuts, was associated with a significantly lower risk of developing type 2 diabetes, even after accounting for body weight, physical activity, and family history. A later meta-analysis published in Diabetes Care pooled data from 25 prospective cohort studies involving more than 637,000 individuals. Results indicated that dietary magnesium was associated with approximately a 17% reduction in type 2 diabetes risk, with a statistically significant dose-response relationship. The protective association appeared strongest among adults older than 55 years. A randomized, double-blind, placebo-controlled trial investigated 400 milligrams of chlorogenic acid daily for 12 weeks among individuals with impaired glucose tolerance. Participants demonstrated significant reductions in fasting blood glucose and measurable improvement in the insulinogenic index, both reflecting more efficient insulin function. A comprehensive review published in Frontiers in Pharmacology during 2026 reported that randomized controlled trials consistently showed chlorogenic acid could significantly reduce postprandial blood glucose and HbA1c while improving insulin sensitivity. Alpha-glucosidase inhibition was identified as a primary mechanism. The complete morning protocol begins with pumpkin seeds. Consume 30 grams, approximately 3 tablespoons, every morning. Choose raw, unsalted, shelled pumpkin seeds. Avoid roasted or salted products. Roasting reduces zinc availability by approximately 25% and can damage heat-sensitive fatty acids linked to anti-inflammatory benefits. Individuals who find the texture difficult may soak the seeds in water for 15 minutes before consumption. This softens them without significantly affecting nutritional value. They should be eaten at or before the first meal of the day. One additional consideration involves calcium. High-calcium foods such as dairy milk can compete with zinc for absorption. Consuming both simultaneously may reduce zinc uptake. Separating them by 30 minutes is recommended. Plant-based milks such as oat milk or almond milk do not present the same concern. The second seed is sesame. Consume 28 grams, approximately 2 heaping tablespoons, each morning. Unlike pumpkin seeds, sesame benefits from light heating. Toasting in a dry pan over medium heat for 30 to 40 seconds is sufficient to crack the outer hull and improve availability of sesamin and sesamolin. Excessive heating is unnecessary. Sesame can be mixed into oatmeal, added to eggs, blended into smoothies, or consumed as tahini. 2 tablespoons of tahini provide a practical equivalent, and grinding may further improve lignin availability. The third seed is sunflower. Consume 28 grams, approximately 3 tablespoons, each morning. Select raw, unsalted varieties. Taking sunflower seeds together with a source of healthy fat, such as avocado, olive oil, or a small portion of walnuts, can improve absor-edit chlorogenic acid delivers its greatest benefit when it is already present within the digestive tract before the highest carbohydrate meal of the day begins. For that reason, consuming sunflower seeds around breakfast or the largest morning meal is considered ideal. The fourth seed in this routine is hemp seed. The recommended amount is 15 grams, equal to roughly 1.5 tablespoons each morning. Hemp seeds contribute something distinct from the other 3 varieties. They contain gamma-linolenic acid, commonly called GLA. This fatty acid serves as a precursor for anti-inflammatory prostaglandins that help counter the persistent low-level inflammation associated with ongoing beta cell decline. Evidence supporting this pathway comes from the gamma-linolenic acid multicenter trial group. In a large multicenter clinical study involving 111 patients experiencing diabetic complications, participants receiving 480 milligrams of GLA daily for 1 year demonstrated significant improvement across 16 measured clinical outcomes when compared with the placebo group. Published findings also indicate that GLA suppresses NF-kappa B, a central inflammatory signaling pathway closely linked to accelerated beta cell damage. It achieves this by interrupting the intracellular sequence responsible for triggering beta cell apoptosis. Preparation is simple. Hemp seeds require no soaking and no heating. Their outer shell is naturally soft and suitable for normal digestion. They can be added to yogurt, blended into smoothies, or stirred into oatmeal. Their flavor is mild with a light nut-like character, making them one of the easiest additions within the entire routine. Several complimentary morning additions were also highlighted. 2 cups of green tea or matcha prepared at 175 degrees Fahrenheit are recommended. Water brought to a full boil can destroy as much as 60% of the catechin compounds responsible for EGCG-related AMPK activation. Dairy milk is discouraged in this context because milk proteins can bind catechins and reduce absorption. A small amount of lemon may be added and may actually enhance availability. Another addition is 1/2 teaspoon of Ceylon cinnamon mixed into coffee, oatmeal, or a smoothie. Ceylon cinnamon contains meaningful amounts of cinnamaldehyde, a compound associated with improved insulin receptor sensitivity. By contrast, the cinnamon commonly sold in many grocery stores is cassia cinnamon, which contains higher levels of coumarin. Daily exposure to elevated coumarin intake may create unnecessary strain on the liver. Checking the label is important. Several common mistakes were identified as reasons people fail to obtain expected benefits from this type of protocol. The first mistake is purchasing roasted and salted seeds. Snack mix products found in grocery store aisles are not equivalent to the seeds used in this routine. Roasting can oxidize delicate fatty acids, lower mineral availability, and reduce concentrations of lignans and polyphenols that are central to the intended effects. For individuals monitoring blood pressure, the sodium content in salted products adds another unnecessary burden. Pumpkin, sunflower, and hemp seeds should remain raw. Sesame seeds are the exception and require only light toasting for the specific purpose already described. The second mistake is expecting immediate results. The biological mechanisms targeted by this approach include mineral restoration, beta cell support, glut sensitization, and hepatic glucose regulation. These changes are gradual rather than immediate. Clinical trials showing the strongest outcomes generally lasted from 10 to 16 weeks. Many individuals following the protocol consistently report their first noticeable change in fasting glucose around weeks 5 through 7. A lack of dramatic movement during the second week does not necessarily mean nothing is occurring. The underlying biological processes may begin before measurable glucose changes become apparent. The recommended commitment period is 90 days. The third mistake involves replacing whole seeds with capsules. This often appeals to people who dislike seed texture or want a simpler option. However, available evidence consistently indicates that isolated extracts do not perform as well as whole food versions. The reason is that fiber, minerals, polyphenols, fats, and other active compounds function together. Their effects depend on interaction rather than isolation. Fiber in pumpkin seeds slows digestion and supports zinc utilization. Fat found in sunflower seeds assists vitamin E transport. These relationships are largely lost when the food is reduced to an extract. For that reason, whole seeds remain the preferred option, while supplements are considered a secondary choice. The fourth mistake is treating the protocol as a substitute for broader dietary improvement. These seeds may provide meaningful biological support, but they are not intended to offset a dietary pattern dominated by processed foods, refined carbohydrates, and sugary beverages. The routine works best as part of a larger shift toward whole food nutrition, rather than as a workaround that removes the need for dietary change. An additional consideration applies specifically to older adults. After age 65, absorption of zinc and magnesium from food tends to decline. Stomach acid production often decreases with age, a process known as hypochlorhydria. At the same time, intestinal transport mechanisms responsible for moving minerals into circulation become less efficient. As a result, older individuals frequently require greater dietary intake of zinc and magnesium to achieve the same blood levels seen in younger adults consuming identical meals. The amounts used in this protocol were presented as appropriate for older adults facing these absorption challenges rather than excessive. One practical preparation strategy may further improve effectiveness. Pumpkin seeds can be soaked in water for at least 20 minutes before consumption. Seeds naturally contain phytic acid, also known as phytate, which can bind zinc and magnesium and reduce absorption by approximately 30 to 40%. Soaking lowers phytic acid content and makes existing nutrients more accessible without altering the food itself. When performed consistently, this simple step may significantly increase the amount of zinc and magnesium the body is able to absorb and utilize. The broader conclusion presented is that type 2 diabetes involves more than elevated blood sugar alone. It also reflects a pancreas that has gradually lost access to key minerals and micronutrients required to support, maintain, and renew insulin-producing beta cells. In many situations, those deficiencies are never addressed directly. Instead, treatment focuses primarily on managing symptoms through medication. Within this protocol, pumpkin seeds provide 30 grams daily in raw form. Their zinc and magnesium content contributes structural support for insulin production and beta cell activity. They serve as the foundation of the routine. Sesame seeds are consumed at 28 grams daily with light toasting. Through lignin activity, they target hepatic glucose production, a process associated with elevated fasting blood sugar independent of the previous evening's meal. Sunflower seeds are also consumed at 28 grams daily in raw form. They contribute vitamin E for protection of beta cell membranes and chlorogenic acid for moderation of post-meal glucose increases through a mechanism similar to that used by certain glucose-blocking medications. Hemp seeds are included at 15 grams daily. Their GLA content supports anti-inflammatory activity directed at the chronic inflammation associated with progressive loss of beta cell function. Together, these 4 seeds focus on 4 separate biological targets. The first is mineral restoration supporting insulin production. The second is regulation of hepatic glucose release. The third is moderation of post-meal glucose elevation. The fourth is protection of beta cells from inflammatory and oxidative stress. According to the material presented, no single medication, supplement, or nutritional strategy addresses all 4 pathways at the same time. When combined with green tea prepared at 175 degrees Fahrenheit, Ceylon cinnamon, and consistent use for 10 to 12 weeks, the routine is described as being supported by peer-reviewed research. The cited evidence includes the Harvard Nurses Health Study examining magnesium intake and diabetes risk, the 2023 phytotherapy research meta-analysis focused on sesame and glycemic control, findings from the gamma-linolenic acid multi-center trial group regarding hemp-derived anti-inflammatory activity, and systematic reviews published in Nutrition Reviews and Frontiers in Pharmacology. The central message is that recovery begins by restoring the nutritional foundation required by the body's own metabolic systems. According to the protocol, that process can begin with a group of inexpensive seeds incorporated into a daily morning routine. The second biological pathway focuses on magnesium and activation of glucose transport systems. GLUT4 impairment, where glucose entry channels in muscle tissue fail to open efficiently, remains one of the major contributors to insulin resistance in type 2 diabetes. Addressing magnesium deficiency is among the most thoroughly studied non-pharmaceutical approaches for improving this problem. A 2025 meta-analysis combined findings from 23 randomized controlled trials involving 1,345 individuals diagnosed with type 2 diabetes. The analysis reported that magnesium supplementation produced significant reductions in fasting blood glucose. An important detail emerged from subgroup analysis. The largest improvements occurred in adults aged 65 and older who maintained supplementation for longer periods. For individuals in the early or moderate phases of the disease, meaningful reductions in fasting glucose achieved through correction of a mineral deficiency represent a notable outcome. The third pathway centers on sesame lignins and regulation of liver-generated glucose. This is where sesame seeds enter the protocol. Many diabetes-focused nutritional approaches pay little attention to the liver, despite its major role in determining fasting blood sugar levels. A substantial portion of the glucose measured first thing in the morning does not originate from the previous evening's meal. Instead, it is produced by the liver through a process known as hepatic glucose production. When this system becomes dysregulated, as commonly occurs in type 2 diabetes, stored glucose continues to be released into circulation throughout the night, even during a 10 to 12-hour fasting period. This explains why some individuals observe elevated morning glucose values despite careful dietary choices the day before. Sesame seeds contain lignins, particularly sesamin and sesamolin. Research indicates these compounds can reduce activity of an enzyme known as glucose-6-phosphatase. That enzyme serves as one of the primary mechanisms through which the liver releases stored glucose. By moderating its activity, sesame lignins may reduce excessive overnight glucose output. This pathway influences fasting blood sugar through a mechanism entirely separate from the others included in this routine. The fourth pathway involves sunflower seeds, vitamin E, and post-meal glucose control. Sunflower seeds rank among the richest plant-based sources of vitamin E, especially alpha-tocopherol. This form has been widely studied for its antioxidant activity on beta cell membranes, which are particularly vulnerable to damage caused by chronic inflammation and oxidative stress. Their second contribution comes from chlorogenic acid. This polyphenol can inhibit alpha-glucosidase, an intestinal enzyme responsible for breaking complex carbohydrates into simple glucose molecules before absorption. When alpha-glucosidase activity is partially reduced, glucose enters the bloodstream at a slower pace following meals. As a result, post-meal blood sugar elevations become less pronounced. Lower spikes reduce immediate insulin demand, place less stress on beta cells, and may help limit long-term cellular strain. Notably, this is the same biological target used by the diabetes medication acarbose. Sunflower seeds provide a naturally occurring source of similar activity without the gastrointestinal effects frequently associated with that medication. Several studies were presented to support these mechanisms. A controlled clinical trial published in the Review of Diabetic Studies during 2025 evaluated adults with type 2 diabetes who received pumpkin seed powder each day for 6 months in addition to standard care. Their outcomes were compared with participants receiving standard care alone. The pumpkin seed group demonstrated meaningful improvement in HbA1c, statistically significant reductions in triglycerides, and favorable changes in multiple lipid markers that were not observed in the control group. Another 2025 systematic review published in Nutrition Reviews by Oxford University Press examined 9 controlled clinical trials involving 316 participants across multiple institutions. Researchers concluded that pumpkin and its bioactive compounds consistently showed potential for improving glucose-related outcomes and metabolic biomarkers among individuals with, or at risk for, type 2 diabetes. The review specifically highlighted the exceptional mineral content of pumpkin seeds, particularly zinc and magnesium, as a likely contributor to these effects. A 2023 systematic review and meta-analysis published in Phytotherapy Research combined data from 8 randomized controlled trials involving 395 participants with type 2 diabetes. Across all included studies, sesame intake reduced fasting blood glucose by an average of 28.61 milligrams per deciliter and lowered HbA1c by 0.99 percentage points compared with controls. An Iranian randomized clinical trial also reported a significant decline in hsCRP, a recognized marker of systemic inflammation, among participants consuming sesame each day. These findings suggested that sesame lignans may support both glycemic control and protection of beta cells from inflammation-related damage. At Harvard's T.H. Chan School of Public Health, researchers conducted a long-term analysis following 85,060 women over 18 years. Higher magnesium intake, especially from whole food sources such as seeds and nuts, was associated with a substantially lower likelihood of developing type 2 diabetes after adjustment for body weight, exercise levels, and family history. A later meta-analysis published in Diabetes Care combined findings from 25 prospective cohort studies involving more than 637,000 participants. Results showed that dietary magnesium intake was associated with an approximate 17% reduction in type 2 diabetes risk. The relationship followed a statistically significant dose-response pattern. Research repeatedly demonstrated that this protective association was strongest among adults older than 55 years. A randomized, double-blind, placebo-controlled trial evaluated 400 milligrams of chlorogenic acid daily for 12 weeks among individuals with impaired glucose tolerance. Participants experienced significant reductions in fasting blood sugar and measurable improvement in the insulinogenic index, both indicators of more efficient insulin function. A comprehensive review published in Frontiers in Pharmacology during 2026 further reported that randomized controlled trials consistently demonstrated reductions in postprandial glucose, lower HbA1c values, and improved insulin sensitivity with chlorogenic acid supplementation. Alpha-glucosidase inhibition was identified as a primary mechanism. These outcomes were not described as dramatic single-meal effects. Rather, they represented steady daily improvements that accumulated over time and eventually translated into measurable changes in long-term glucose markers. The morning protocol follows specific amounts and preparation methods aligned with the studies discussed. Pumpkin seeds are consumed first. The recommended amount is 30 grams, equal to approximately 3 tablespoons each morning. They should be raw, unsalted, and shelled. Products labeled pepitas fit this description. Roasted and salted versions are discouraged because roasting reduces zinc availability by approximately 25%, while also damaging heat-sensitive fatty acids associated with anti-inflammatory benefits. For older adults who find the texture difficult, soaking in water for 15 minutes before consumption can soften the seeds, without reducing nutritional value. They are intended to be eaten at or before the first meal of the day. A separate consideration involves calcium intake. Dairy milk and other calcium-rich foods compete with zinc for intestinal absorption. Consuming them together may significantly reduce zinc uptake. Allowing a 30-minute separation is recommended. Plant-based alternatives such as oat milk and almond milk do not create the same issue. The second seed is sesame. The suggested amount is 28 grams, or roughly 2 heaping tablespoons each morning. Unlike pumpkin seeds, sesame benefits from brief heating. Toasting for 30 to 40 seconds in a dry pan over medium heat helps crack the outer shell and improve availability of sesamin and sesamolin. The goal is not deep roasting. Only light heating is required. Sesame seeds can be mixed into oatmeal, added to eggs, blended into smoothies, or consumed as tahini. 2 tablespoons of tahini provide a practical equivalent, and grinding may further improve lignin availability. The third seed is sunflower. The recommended intake is 28 grams, approximately 3 tablespoons each morning. These seeds should remain raw and unsalted. Vitamin E absorption improves when sunflower seeds are eaten alongside healthy fats, such as avocado, olive oil, or a small serving of walnuts. They may be consumed with pumpkin seeds or during the mid-morning period. Because chlorogenic acid performs best when present before the highest carbohydrate meal of the day, breakfast timing is considered optimal. The fourth seed is hemp. The suggested serving is 15 grams, approximately 1.5 tablespoons each morning. Hemp seeds provide gamma-linolenic acid, or GLA, a precursor involved in production of anti-inflammatory prostaglandins. The gamma-linolenic acid multicenter trial group conducted a large multicenter clinical trial involving 111 patients experiencing diabetic complications. Participants receiving 480 milligrams of GLA daily for 1 year demonstrated significant improvements across 16 measured clinical parameters compared with placebo. Published research also reported that GLA suppresses NF-kappa B, a major inflammatory signaling pathway associated with accelerated beta cell destruction, by interrupting the intracellular sequence leading to beta cell apoptosis. No preparation is required. Hemp seeds do not need soaking or toasting. Their naturally soft outer layer supports normal digestion. They may be sprinkled over yogurt, mixed into oatmeal, or blended into smoothies. The flavor remains mild and slightly nut-like, making them one of the easiest components of the routine to incorporate. For additional support, 2 cups of green tea or matcha, prepared at 175 degrees Fahrenheit, may be included each morning. Boiling water can destroy as much as 60% of the catechin compounds associated with EGCG-driven AMPK activation. Dairy milk is avoided because milk proteins can bind catechins and interfere with absorption. A small amount of lemon may be added. Another optional addition is 1/2 teaspoon of Ceylon cinnamon in coffee, oatmeal, or smoothies. Ceylon cinnamon contains cinnamaldehyde, a compound associated with improved insulin receptor sensitivity. Cassia cinnamon, commonly sold in many stores, contains higher levels of coumarin, which may create unnecessary liver burden when consumed daily. Several common errors can limit results. The first involves purchasing roasted and salted seed products. Roasting damages fragile fatty acids, reduces mineral availability, and lowers concentrations of important lignins and polyphenols. Raw pumpkin, sunflower, and hemp seeds are preferred. Sesame remains the sole exception requiring light toasting. The second error is expecting rapid changes. Mineral restoration, beta cell support, GLUT sensitization, and hepatic glucose regulation require time. Clinical trials showing the strongest outcomes generally lasted 10 to 16 weeks. Many participants first noticed meaningful changes in fasting glucose between weeks 5 and 7. A 90-day commitment was recommended before evaluating results. The third mistake is replacing whole seeds with supplement capsules. Research suggests whole foods outperform isolated extracts because fiber, fats, minerals, and polyphenols function together. The fourth mistake is viewing the protocol as a substitute for broader dietary improvement. These foods may support metabolic health, but they are not intended to offset a diet dominated by processed foods, refined carbohydrates, and sugary beverages. One final consideration applies to older adults. After age 65, absorption of zinc and magnesium declines as stomach acid production decreases and intestinal transport mechanisms become less efficient. Because of these changes, older adults often require greater dietary intake to achieve the same circulating mineral levels observed in younger individuals. A practical preparation strategy involves soaking pumpkin seeds in water for at least 20 minutes. Seeds naturally contain phytic acid, also called phytate, which can reduce zinc and magnesium absorption by approximately 30 to 40%. Soaking lowers phytate content and improves mineral accessibility. In summary, this protocol presents type 2 diabetes as a condition involving not only elevated blood sugar, but also progressive depletion of minerals and micronutrients required for beta cell maintenance, protection, and renewal. Pumpkin seeds provide 30 grams daily of zinc and magnesium to support insulin production and beta cell function. Sesame seeds supply 28 grams daily to influence hepatic glucose production through lignin activity. Sunflower seeds provide 28 grams daily of vitamin E and chlorogenic acid to support membrane protection and post-meal glucose control. Hemp seeds contribute 15 grams daily of GLA to help address chronic inflammation associated with ongoing beta cell decline. Together, these 4 seeds target mineral restoration, hepatic glucose regulation, post-meal glucose moderation, and protection against oxidative and inflammatory damage. Combined with green tea prepared at 175 degrees Fahrenheit, Ceylon cinnamon, and consistent use for 10 to 12 weeks, the protocol is presented as a research-based approach supported by findings from the Harvard Nurses Health Study, the 2023 Phytotherapy Research Meta-Analysis, the Gamma-linolenic acid multicenter trial group, nutrition reviews, and frontiers in pharmacology. If you found this information valuable, share it with others who may benefit from learning about these nutritional approaches and continue exploring evidence-based strategies that support longevity. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.